Dr. Sandeep Samant began his medical career at All India Institute of Medical Science in New Delhi. After completing medical school, Dr. Samant's chosen specialty, otolaryngology, brought him to Stockport Infirmary in the United Kingdom. Then fellowship training in head and neck, as well as microvascular surgery at the University of Miami. Although Dr. Samant had the opportunity to practice medicine in other places throughout the country, he chose to call Memphis his home.
Dr. Sandeep Samant is an ideal faculty member. He's really devoted to the missions of the university, from clinical care to education to research, and of course the service mission as well. But the many hours that he spends in patient care, really trying to meet the needs of each patient. And he meets those needs on a personal level, but he also meets those needs by being a just technically superb surgeon.
The way he made eye contact with me, and he talked to me, and I could tell he was serious about his job, about everything that was going on. And another thing, he would come in the room after I'd been waiting for him to come in there, and he wasn't in a rush. He was sat down and he answered all of my questions, answered my parents' questions. He made sure that I got to say what I needed to say. He made sure that he said what he needed to say. And to have a doctor that you feel like is really listening to you, well, it makes you feel like maybe you know, it's really not that bad. That's how it made me feel.
Like most people, when you meet Dr. Samant, you think, he's awful young to be a surgeon. I mean, he got this boyish good looks. And you think, wait a minute, it takes 7 years to get through medical school and then additional years for surgery and the specialization. He can't be old enough. But as soon as he starts speaking, you realize that this man is very intelligent.
Dr. Samant's expertise in otolaryngology presented him with new challenges and opportunities to fight head and neck cancer, a disease that strikes 40 to 50,000 Americans each year. His continued quest for innovation brought new treatments, such as robotic and minimally invasive thyroid surgery, to the Mid-South. In fact, he was the first surgeon in the region to perform transoral robotic head and neck surgery.
When I first heard about the Da Vinci robotic surgery that he was offering, to me, I was just a godsend. Because when you hear about what the alternative is, you say, thank God for putting me here at this time. If I have to have this disease, this is the way I want it cared for. The traditional way of treating cancers on the tongue and deep in the throat, they split your face open. Just cut your jaw right in half and splay you open so they can get down inside. But Dr. Samant was the third doctor in the country to use the Da Vinci robot to go and take care of those kind of cancers. And so much less invasive, and your recovery time is sped up tremendously.
The best thing I like about him is just the confidence that he gives you. I learned before I talked with him from others that he was excellent in his technique, and Memphis was lucky to have him, and the fact that he's here and wants to stay in Memphis.
Well, he was very thorough in his explanation. He seemed to really know what he was doing. It wasn't a, well, we're going to try this, or well, we're going to try that. He had a plan. He knew what he was going to do.
Sandeep's been one of the pioneers in this community for multidisciplinary care, which is aimed at very comprehensive and yet individualized care. And he has been open to collaborate and to work with anybody in this community. He's been very eager to work. He's not a solo flight person. He's a team player.
We think of cancer care in Memphis. Very often, the doctor will say to the patient, well, the best way to do this is a certain technique, but really you have to go to MD Anderson, for example, or Sloan Kettering in New York City for this. But when it comes to head and neck surgery, you can get the best treatment right here, and Sandeep Samant is your man.
Well known for his technical surgical skills, Dr. Samant is also well known by his patients for his dedication to providing quality care.
I believe Sandeep's bedside manner is very, very strong, very gentle, very committed, and his connection with patients has been very good.
He took out my jawbone, which was where the tumor was located. And he took the fibula out of my left leg and replaced my jawbone with the fibula. And as you can see, it looks really good. I think I look good. And now I'm back to doing things that I like to do. It's been 7 months since my surgery. I'm horse riding again. I'm ready for the summer. I'm ready to do all my outdoor stuff. And I feel like I'm back to where I need to be. And I'm happy. And it's all because of Dr. Samant.
I always had that feeling as I talked with Dr. Samant that he truly cared about me. And you need that feeling when you're in that kind of situation.
When I was laying in the room where actually, I guess it's the pre-operated room, there was a nurse and she said, "You've got the best." She said, "If it was my father, I would recommend Dr. Samant." So that made me feel good.
When he is sitting in that room with you, you feel like you're the only one that matters to him at that moment. And I tell you something else that's very important to me. You can get a good idea on just how good of a surgeon he is by the quality of people that surround him. Good people want to work for him and learn from him. And he has got some good people around him, and that's critical.
That's the kind of person that we're very happy to have as a part of our cancer mission, and someone that we can build a cancer center around with a very strong head and neck program. And in particular, myself and Lee Schwartzberg, who's the director of the Methodist University of Tennessee West Clinic Cancer Center, are working to build a head and neck cancer program around the superb skills of Sandeep Samant. Another important thing that maybe not everyone knows is how dedicated Sandeep is to the educational mission, whether it's students or whether it's residents. I was actually at his home for a holiday party this year for the residents, and in talking with the residents, they're really so pleased with their interaction with him from the educational point of view, from seeing him as a surgeon, and from looking at him as a role model as well. Finally, in the research agenda, we're looking forward to building around Sandeep again a head and neck research program which would be focused on either early detection, mechanisms of treatment, disease pathogenesis in head and neck cancer, and everything is stimulated by the tremendous activity, the clinical activity that he has and the special skills that he brings to the table.
Dr. Samant's efforts have touched the lives of many, from students to residents to patients. He's building a legacy of excellence and quality care in the Mid-South.
Our city medical service is just outstanding, and Dr. Samant is a very important part of that.
I just can't think that you're going to find better care anywhere in the world, certainly in the country.
Every time I go back to see Dr. Samant, I always say, I thank you for your good work.
I think he's a great doctor, and I'm just so glad that I met him and I was referred to him, and I'll never forget him, ever.